Many women are suffering from polycystic ovarian syndrome, but the problem is most of our ladies don't even know how to check if they have this particular condition. They might be having the signs and symptoms, but they don't even know how to check themselves to verify if they have this particular condition. And that is why I'm making this video, so I will tell you how to check yourself to know if you're having polycystic ovarian syndrome. Because I keep seeing complaints of people saying I'm having irregular menses, I'm not seeing my menses, I do see my menses twice a month, I don't even see my menses for like 2-3 months, and they feel it's a normal thing. They only feel maybe it's a thing that will go on its own, not even knowing these are early signs of polycystic ovarian syndrome. So here in this video, I'll be telling you everything you need to know about polycystic ovarian syndrome and how to treat polycystic ovarian syndrome successfully. So if you're seeing this for the first time, do well to hit on the subscribe button, because these are the kind of videos I'll be dropping every day for your consumption. So before going further, let us discuss what is polycystic ovarian syndrome before advancing into the signs and symptoms, how you can manage and treat polycystic ovarian syndrome to prevent complications linked to this particular condition, because there are a lot of complications attached to this particular condition if not noticed early. But because you're watching this video, you will not have the complications, because I believe you will notice it early after watching this video to the end. Now, polycystic ovarian syndrome is a condition that causes abnormal growth around your ovaries. So when they carry out tests or they carry out scan on your ovaries, they notice an abnormal growth around your ovaries. Now, what happens when that growth has been produced on your ovaries is that particular growth, which is abnormal, start producing your follicles. They will contain your follicles. So you as a woman will not be ovulating where you're supposed to ovulate. It will cause hormonal imbalance in your body. And as a woman, you also experience irregular menses. You'll be experiencing, miscarriage if you're pregnant. And you might also be experiencing skip menses. So after 2 months or 3 months, you'll not see your menses and you'll be wondering what's the cause. It is linked to polycystic ovarian syndrome due to the fact that it causes hormonal imbalance. And don't forget that hormonal cycles, your menstrual cycle is all controlled by hormones. So when these hormones are not balanced, you'll be having hormonal imbalance. Because you're having hormonal imbalance as a woman, you'll also be experiencing mood swing. You'll be having, sudden mood swing without any cause. This is mostly linked to polycystic ovarian syndrome, because when your hormones are not balanced as well, your body will not produce happy hormone in adequate quantity. So you always be having mood swing, you'll not be happy, you'll be feeling to isolate yourself from people, you'll not like to just live around people. This is all linked to polycystic ovarian syndrome. That is not just it, it also makes your body to produce androgen hormone. As a woman, you'll be producing the male hormone, which is called androgen. And because you are producing male hormone, you start having hair on places you are not supposed to have hair. You either be having hair on your jaw and different places like that, which you are not supposed to have. You might also be experiencing severe hair loss. So you just notice that your hair are just going off your body. You might also experience, abnormal weight gain. So as a woman, you just notice a kind of sudden weight gain within 2-5 months, and you'll be wondering what's the cause. These are all linked to polycystic ovarian syndrome. Now, there are tests in which you can carry out to check if this particular condition is actually polycystic ovarian syndrome. And one of the tests you can carry out is ultrasound scan to check if there is growth on your ovaries. So if you notice a growth on your ovaries, then you will now confirm that you are having this particular condition. And you can also carry out a hormonal profile check to know if your hormones in your body are all balanced. If they are imbalanced, then you should be suspecting polycystic ovarian syndrome. And they can also check your blood sugar level, because most of the complications of polycystic ovarian syndrome is that it causes a upshoot and downshoot of your blood sugar level. So if you notice that your blood sugar level is abnormal, either it's high or low, it's all linked to polycystic ovarian syndrome. Now, there are ways in which this particular condition is being managed. Doctors recommend different kinds of medication based on the signs and symptoms you are presenting with, because signs and symptoms varies from person to person. The sign and symptom that Lady A will have is not the sign and symptom that Lady B will get. So you might have all the sign and symptoms I've explained, and the other lady will not have all the sign and symptoms. The lady might just have maybe 2 or 3 of all these particular sign and symptoms I've explained. And one of the major medications that doctors will recommend to you is a medication to regulate your hormonal cycle. So they'll prescribe hormonal pills to you to regulate your menstrual cycle and to regulate the hormones of your body. They might also prescribe anti-androgen medications for you to reduce the rate at which your body lost hair. And for ladies who are finding it difficult to get pregnant, they will also prescribe fertility medications to you to boost your fertility. Because when you are having polycystic ovarian syndrome, the rate at which you can get pregnant will be reduced. So for them to boost your fertility, they will need to give you medication which will boost your fertility. Now, you might also need to change your lifestyle by eating adequate diet, resting, carrying out exercise, not vigorous exercise, but a kind of normal exercise to make sure your body is in a state of health. So if you enjoyed this video, do well to subscribe to my channel. Thank you for watching this video. I'll see you next time.